Welcome to this video on field epidemiology based on Chapter 10 of Introduction to Epidemiology by Ray M. Merrill. Field epidemiology brings public health science to the real world. This chapter explores how professionals investigate outbreaks, track cases in real time, and respond to health threats with urgency and accuracy. Whether it's foodborne illness, a meningitis cluster, or an international pandemic, field epidemiologists are on the front lines. What is field epidemiology? Field epidemiology is the application of epidemiologic methods to unexpected public health problems that require timely investigation and intervention. It typically involves urgency in response, on-site problem solving, limited or evolving information, coordination between health departments, labs, and communities. The goal is not just to understand an outbreak, but to control and prevent it as quickly as possible. Types of field investigations. There are several types of situations that call for field investigation. The first is an outbreak, which is the occurrence of disease above what is normally expected in a defined population and time. The second is a cluster, which is an aggregation of cases in a given area or period, even if not proven to exceed expected levels. The third is a public health emergency, which includes bioterrorism, chemical spills, or rapidly spreading infections. Field investigations may also address chronic disease surveillance, environmental exposures, and vaccine-preventable disease tracking. Steps in an outbreak investigation. A standard outbreak investigation follows several steps. The first is to establish the existence of an outbreak. This means verifying that the number of observed cases exceeds the expected baseline. The second is to confirm the diagnosis. This includes clinical assessment, laboratory testing, and ruling out unrelated conditions. The third is to define and identify cases. Investigators create a case definition, which includes person, place, time, and sometimes lab confirmation. The fourth is to describe and orient the data. This means organizing case data by time, place, and person. The fifth is to develop hypotheses about the source, mode of transmission, and contributing factors. The sixth is to evaluate hypotheses using analytical epidemiology, often through case control or cohort studies. The seventh is to refine hypotheses and carry out additional studies if needed. The eighth is to implement control and prevention measures. This step can begin earlier if the source is obvious. The ninth is to communicate findings to stakeholders, health officials, and the public. These steps may overlap or be revisited as new data emerge. Components of a case definition. A case definition is a standardized way to identify and count cases during an outbreak. It includes clinical criteria, time period when the illness occurred, geographic location or setting, person characteristics such as age, occupation, or exposure. Case definitions may be sensitive at first and then refined to be more specific as the investigation progresses. The epidemic curve. An epidemic curve is a visual display of the onset of illness among cases over time. It helps show the magnitude and pattern of spread, suggest type of outbreak, identify outliers or peaks, estimate the incubation period if the exposure date is known. A steep rise and fall may indicate a point source outbreak. A flatter curve may suggest a continuous exposure or person-to-person spread. Descriptive versus analytic fieldwork. Field epidemiologists use both descriptive and analytic approaches. Descriptive epidemiology includes who got sick when symptoms began, where the cases occurred. Analytic epidemiology tests hypotheses using comparisons between groups. This often involves case control studies where exposure histories of sick and well people are compared. Cohort studies, especially in defined groups like schools or camps. Analytic methods help confirm the suspected source and guide control measures. Control measures and communication. Once the source is known or suspected, control and prevention measures are implemented. These may include removing a contaminated food item, closing an infected facility, providing vaccination or prophylaxis, public education to prevent further spread. Communication is essential. Findings must be shared with local and national health authorities, affected populations, the general public when appropriate. Clear messaging builds trust, ensures compliance, and can save lives. Let's review the essentials of field epidemiology. Field epidemiology responds to urgent real world health threats. Outbreak investigations follow structured steps from detection to control. Case definitions, epidemic curves, and descriptive data guide early responses. Analytic studies test hypotheses and confirm sources. Communication and prevention measures are critical parts of the process. Field epidemiologists combine science, critical thinking, and public service, often under pressure. Their work protects communities and strengthens the health system every day. Thanks for watching. In the next chapter, we will explore chronic disease epidemiology and the unique challenges it brings.